Carotid artery diseases are defined as the narrowing or the blockage of the carotid arteries. These two conditions are called carotid artery stenosis or occlusion respectively, and they are usually caused by cholesterol deposits and fatty substances which are called plaque. In addition, they represent significant causes of strokes, thus they should be a part of regular physical examinations. An important and preliminary diagnosis is to listen to the arteries in the neck using a stethoscope or a Doppler ultrasound device. However, it's sometimes very difficult for a non-professional physician to differentiate between a normal and abnormal sound due to blood flow blockage. So there is a need for a low-cost and yet efficient screening method for the detection of the carotid artery diseases. The proposed approach consists of the following main steps. Firstly, Doppler ultrasound signals are pre-processed for noise elimination. Then some features for normal stenosis and occlusion signals are extracted from the frequency domain of these signals using their spectrograms. A multi-layer feed-forward neural network and a k-nearest neighbor classifiers were used to automatically diagnose the input signals. The approach is applied to 72 samples divided into 3 equal sets, which represent the 3 main classes to be identified, which are the normal, stenosis, and occlusion cases. The spectrograms of a sample of the 3 patterns are shown in the presented figures. It's clear that the spectrograms have different characteristics. These figures show the mappings of the 3 main classes to be identified using the 5 extracted features. The red points represent the normal patterns, while blue points represent the stenosis patterns, and finally the green points represent occlusion patterns. This table presents the confusion matrix for the classification problem. As shown in the table, only 3 patterns are misclassified. Also, the classification accuracy for the normal case is about 92%, and for the stenosis case it's 100% accuracy. Finally, the accuracy for the occlusion case is about 96%, and the total classification accuracy is about 96%, which is a very promising accuracy for such a low cost and a fast screening method. Furthermore, as shown in the confusion matrix, the sensitivity is about 98%. Meanwhile, the specificity is about 92%. In this paper, a method for the screening of carotid artery diseases is proposed. The main contribution of the proposed work is the utilization of the low-cost pen probe Doppler ultrasound audio device instead of the expensive ultrasound imaging modality. Also, we employed only 5 features, which reduced the time of the test to the minimum. In addition, good results were obtained. This makes the proposed approach more suitable as a screening method for the carotid artery disease in comparison with similar approaches, especially in highly populated areas. Future work includes the application of the suggested system on a larger data set to add more power to the generalization, in addition to the integration between the proposed approach and other medical imaging modalities. Thank you.